I'm Dr. Gustav Lowe, Medical Director of Cosmetic Skin and Laser Center in Petoskey and Traverse City. Electronic brachytherapy is a very complicated sounding term describing a really simple procedure, using very targeted x-rays to treat certain types of localized cancer. In our practice, we use electronic brachytherapy to treat non-melanoma skin cancer, which usually means squamous cell or basal cell carcinoma. Those are considered to be sort of nuisance types of skin cancers because they're generally not very dangerous. It's very rare that they spread or metastasize and threaten somebody's life. But they do have to be treated. Otherwise, they'll destroy the surrounding tissue and organs, and if left long enough, they actually can become dangerous. Now, in the past, treatment has been primarily surgical. There's even a special term for certain types of skin cancer surgery. It's called Mohs surgery. But whether it's Mohs or any other technique, the doctor simply cuts out the skin cancer and sews your skin back together. Or in some areas, they'll actually leave the wound open and let it heal by sort of filling in the hole on its own. Now, the big advantage of electronic brachytherapy is that it's non-surgical. We don't remove any tissue at all. So there's no incision, there's no stitches, and therefore no scar from the incision. The X-ray treatment targets just the cancerous skin and a very small area around it. The cancerous tissue is destroyed, and new healthy skin tissue forms in place of the cancerous tissue. It's really just that simple. At Cosmetic Skin and Laser Center, all the evaluation and treatment occurs right here in our office. You don't have to go anywhere else. Your first visit will be with a radiation oncologist, a doctor who specializes in treating cancer with different types of devices, different types of radiation. Now, based on that examination, he or she will develop a treatment plan specifically for your situation, which usually consists of about 8 treatments over a 4-week period of time, though in some cases it may take a few more treatments. Then about twice a week, you come back here into the office for a treatment by a therapist using a device that looks a lot like this. The treatment's painless, takes just a few seconds really, and you'll never have to be here more than 15 minutes total. You won't feel any discomfort after the treatment, and there are no restrictions on your activities. The cancerous tissue is damaged by the radiation and progressively shrinks down and fades away over a period of weeks to months, well after your 4-week treatment series is over. Now, as with any medical procedure, there are advantages and disadvantages to both the surgical route and electronic brachytherapy. Your provider will go over your case in detail and discuss your options. But the most important thing is that comparative studies show electronic brachytherapy has the same percentage cure rate as Mohs, and equal, if not better, cosmetic outcome. Because of course, there's no incision and no tissue is removed. So in those two important ways, cure rate and cosmetic outcome, the two are considered by many to be equivalent. There are certain parts of the body where brachytherapy is probably a better choice because the skin doesn't heal well after surgery, like the shins, for example, or because the skin's very tight and it's hard to actually sew it back up and have it look good. And the scalp and forehead are good examples of that. There are also situations where surgery may be a better choice, like when transportation to and from our office is a problem, because a treatment course is going to be at least 8 visits with electronic brachytherapy, and with surgery, it'll probably be just 2 visits. In fact, we still do a lot of simple skin cancer removals the old-fashioned surgical way. But we're excited about electronic brachytherapy because now we can cure skin cancer with a device without scalpels and stitches and scars and all that. And we can treat it easily and in areas that were very difficult before. Your provider will discuss your situation with you in more detail, and then you can decide which way you want to proceed.